we are, we're fine.
So Dave texted me this morning, oh, there's tons of accidents on, on 40 and you're gonna be late, just you try to leave early. I'm like,
Who texted me?
Stephanie, there's one of me, and it was kind of smooth traffic.
That's what Elizabeth said.
It was like nobody was on the road, got no stops, no slowdowns, no nothing. It was like the best day ever.
Because you didn't have to go across the bridge, right? You?
Well, not this, I
No,
come,
Illinois.
no, I come from Troy, Missouri, so I come in
Oh.
6140.
If Dan comes from Illinois, and he said it takes him 25 minutes, took him an hour and 25 minutes.
Oh, my
Today.
gosh.
Yeah. The 64 had accidents all over
Oh,
Illinois.
that's terrible.
I saw that and I was like, I wonder if Dan's working from home today.
Yeah.
Just after I got, because I ain't doing this, I'm going home.
I usually get fairly, I mean, I've had some sticky days on the way, but
These are my fault. I'm green things.
Test, test.
Good morning. Another year is coming to an end. Another year challenged by a pandemic that brought new infections, new variants, and even more death. But the year also brought wide access to vaccines, allowing families to gather and kids to return to the classroom and businesses to remain open and keep our economy moving forward. The year began with hope and relief. However, with wide access to vaccines, we also saw a wave of misinformation filling social media feeds and county council meetings. It was as if there was a race to see which could spread more quickly. COVID-19 lies about the mitigation efforts or COVID-19 itself. At county council meetings, speaker after speaker shares dangerous misinformation about the virus, vaccines, and masks. And last week, a speaker delivered some of the most hate-filled, anti-Semitic speech that I've ever heard. Thank you to the council members who condemned the hate and have demanded it be gavelled down in the future. As a result of the free-for-all forum of hate and intentional false statements, those who want to step up and support public health decisions instead stay home. Voices of reason do not feel comfortable sitting in a crowd of unmasked people who say the virus isn't real. The vaccine is deadly, and the masks don't work. Let me stop here to say what I thought was obvious. The virus is real, and over 800,000 Americans have died from it, including 2,691 right here in St. Louis County. The vaccines are effective and safe. They're saving lives. Just over 61% of Americans are fully vaccinated. Masks do work, and you should wear one in indoor spaces, including the council chambers. I have asked the council to take up a mask order in whatever form it thinks the state requires. Our number of cases continue to go up as more people gather indoors and travel for the holidays. And we are now averaging more than 350 cases a day and expect to see a bump over Christmas. Now is not the time to let up on wearing masks. Now is the time to get a vaccine if you have not had one yet, and a booster if you are eligible. COVID has dominated the past 2 years of our lives, and I know that people are frustrated that the virus continues to spread as new variants emerge. A lot of people would like to retire their masks, but don't yet because there are still too many unvaccinated people. If there were stronger compliance with mask wearing and more people vaccinated, then we would see our case numbers drop and more people would feel safe to move about. And I want to thank our school boards across the county who have had to make incredibly difficult decisions, sometimes faced with a great deal of vitriol. All districts weigh mask requirements versus mask recommendations, and I appreciate the time you're putting into those decisions. I know it's not easy, and your votes come with what you believe is best for children. When I'm standing here a year from now, my sincere hope is that COVID will be in the rearview mirror and we can focus our efforts elsewhere. Great things are happening in the region. Direct flights to Europe were announced this week. Millions of dollars are coming into St. Louis County from the RAM settlement and the federal infrastructure bill. Projects long deferred because of budget constraints can now be addressed. And more jobs will be coming online. The Port Authority last week took some critical steps to help in the redevelopment of the Jamestown Mall site. Contracts were approved for asbestos abatement and waste removal to prepare the old mall for demolition. And another contract was approved for a market analysis and feasibility study of the site. We continue to address the public health crisis while working to ensure that the region continues to grow and prosper. Cooperation between elected leaders, business leaders, and economic development leaders is paying off. Thank you, and I'd be happy to answer any questions.
there any evidence yet of Omicron being present in St. Louis County?
The question is evidence of Omicron in St. Louis County. I spoke to Health Director this morning, and he told me as of yet, we do not have any confirmation of any evidence of Omicron in St. Louis County. Genetic testing is not as robust as we would like it here, but we're watching the sewer sheds, and we're watching it very closely.
As far as asking the council to pass a mask mandate, is there any possibility that that could come through emergency legislation at tomorrow's meeting, at the last meeting of the year?
Well, the easiest way to pass a mask mandate would simply accept the public health order that's been presented, and that could be done in a moment, in a vote. An ordinance takes longer, and that's been on the agenda, and they can take it up whenever they decide to do that.
Can you explain what the budgetary situation was? I know that the Post-Dispatch wrote about that last week, but I think that tomorrow is the last meeting, and I assume that they're gonna pass the budget. Like, how much rescue plan money is gonna be in there to fill potential budget gaps?
Well, the question is about the budget, and the initial budget bill that was passed last week cut several $1 million from existing programs in the county health department, and the council, individual council members have indicated that they'd like to replace that when they vote tomorrow. There were several other cuts made in the recommended budget that had many new programs in St. Louis County, including programs for opioid treatment in the county because we know that opioid deaths have gone up over the past year, and a comprehensive land use plan. And this is especially important in North County as this infrastructure money comes online. Some of that would be funded from ARPA, and the council just has to decide if they're ready to put those ARPA funds to work. We have a lot of needs in St. Louis County, and we'd like to get busy addressing them. They did indicate, some council members indicated that they wanted to hear from our outside consulting firm, Deloitte, that these funds were eligible for ARPA, and we hope to have the answer from Deloitte to share with council members today.
With Omicron looming, and you still have a council that sometimes has been hostile to you, what do you think 2022 will bring as far as you working together with the council, with COVID still a real issue?
Well, the question is about the council and my office being able to work together, and I think that'll be on an issue-by-issue basis. I don't think we'll see too much of county council members voting on what's in the best interest for their constituents, because I'm also for it, but we'll see. In the past, the county council has supported public health orders, has supported mask mandates. They didn't when they were presented with the opportunity to do so most recently. As COVID continues to get worse in our region, they'll have a chance to reconsider that decision.
Do you think it's going to be exacerbated by the fact that it's an election year and you're up for election again?
Well, there are a lot of people on the ballot next year, and it's an even-numbered year. And I expect you'll see a lot of activities that can be attributed in positions taken in politics that can be attributed to the presence of an election year, sure. That exacerbates everything that's done in the state legislature, and certainly things that are done in the county council, because the county council tends to get drawn into partisan things that are happening at the state and national level.
We had a question with the budget. There are a few items there using ARPA funds that the council has said that they wanted to delay into the next month. Some of that, like ARPA money for the prosecuting attorney's office.
Mm-hmm.
Are you concerned that those decisions will get bogged down in some of the politics of the election year?
Well, so the question is about the county budget for next year and it becoming a hostage of council politics. That's always a risk, and we see that at the federal level too. I mean, we're trying to get our Build Back Better bill passed, and it's become a hostage of the political climate in Washington, D.C. We see decisions made in the state legislature where appropriations and policy decisions become a hostage of the political environment, and that's certainly a risk here in St. Louis County. I hope the council can work through that and disregard the politics of an election year and do the work that we need to get done for people in St. Louis County.
I know there's been a lot of discussion about a mask mandate, but from what I'm seeing, the cases with Omicron are about to shoot up beyond any level that we've seen. And there could be clamoring for more than just a mask mandate. There could be clamoring for occupancy restrictions or stuff like that. How does the state law requiring a council vote for stuff like that, as well as the Cole County decision, make it more difficult for your office to do that if there is a public demand for it?
So the question is as multifaceted as we often get. Thank you.
You're welcome.
So I'll try and march through it in a structured way.
Sure.
So the question is about public health orders, given the expected rise in cases of Omicron based on what we've seen across the world and in other parts of the country. And we do expect Omicron cases to, and cases in general from COVID to continue to increase. That's what our public health experts are telling us. So the question is, what do we do with public health orders in the presence of recent state litigation that is mired in the courts because of a very strange verdict out of Cole County that impacts us in ways that no one completely understands. And we need further court action to figure that out. We believe that our county health department can continue to promulgate health orders in whatever form, and those orders will need to be supported by the county council based on state law. And if the county council doesn't do it, then it'll be much more difficult unless the Cole County decision is reversed on appeal. We expect that it is such a poorly written decision that someday it will be reversed. The question is in what court and in what setting. And if that happens in time to change things in the next 90 days, I don't know. As far as what will the county council do and what will the public ask for, those are all variables. What I will do is support the recommendations of the public health department and the public health experts, the pandemic task force, and others. And the public will certainly be involved in that conversation as it has since the beginning of the pandemic on both sides. Some asking for more restrictions, some asking for less. But what we do in St. Louis County will be driven by our public health experts with consultation of the health systems and the pandemic task force and following the guidance of the CDC.
Anybody else? Thank you.
Okay, thanks.